The report on the sexual reproductive health rights highlights gaps in national representative data on reproductive cancers and STIs.
Issues around reproductive cancers, where there is some evidence here and there, it's not consolidated in any form. And we also have issues, lack of data on some of the sexual rights and needs of the elderly population. But this is a very critical population in Uganda.
The International Center for Research on Women cited gaps of sexual and reproductive health rights towards the elderly, often overlooked in favor of the youth.
Focus for sexual reproductive health and rights has been so much on sexual reproductive health for the age group 15 to 49. There is no evidence, there is no data. There is so much that is lacking in this area. How do we perceive ourselves, our bodies, when we get into that age?
The uncertain policy landscape and ineffective public messaging further hinders progress.
A good example that I can give is the law on abortion, where you have a policy direction, again the 2006 guidelines, which allow for abortion when maternal illness, sexual violence, but also for fetal abnormalities. But then when you go to the law, this is not captured. It only talks about when the life of a mother is at risk.
The society has one goal, and the goal around young people particularly is the preservation of life, the upholding of their dignity, and the respect of their autonomy and existence. For that matter then, we need to start telling our stories or sharing our experiences from a more inclusive language that allows people to identify with us.
Dr. Alan Kasozi from the Ministry of Health's Adolescent Division called for stronger advocacy, highlighting the key government interventions towards sexual reproductive health rights.
This is, in a sense, to have collective accountability because there's a number of stakeholders. Mothers don't only die just because they're in the hospital or for lack of care. There is so much going on in the communities. Young girls are getting pregnant. That is not an issue for health. That's an issue for everyone. Parents, community leaders, politicians, okay?
Cayenne Faith, Nanono Smaya, for UBC.